Like all living things, humans need energy for survival, and our main source of energy is sugar. Without it, we can't function, but too much of it can be a bad thing. Normally, the body digests food down to its simplest form to be absorbed into the bloodstream so that we can utilise the nutrients. Put simply, sugar is the simplest form of soluble carbohydrate that our body absorbs from sweet and starchy foods. Higher sugar level in your blood after a meal is an expected and normal reaction due to the food you've just eaten, and the process is usually transient. If we need sugar then, what makes somebody a diabetic, and how is this different to someone without diabetes? When sugar levels remain persistently high in our bloodstream for prolonged periods of time, even before a meal, this is when the condition becomes diabetes. So for people with diabetes, why or how does this happen? Some of you may have already heard of type 1 and type 2 diabetes. Unfortunately, there are many causes for diabetes, and it's a complex topic which deserves a video in its own right. But as a start, type 1 is generally the result of the inability of the pancreas to produce insulin, or hormone used by the body to keep blood sugar levels down. Type 2 is typically caused by diet, lifestyle and other factors where our body gradually becomes unable to properly respond to insulin even though it's being produced. In both cases, diabetes is diagnosed when sugar concentration in your blood remains persistently high. Some people may experience thirst, lethargy, even weight loss, but in the early stages, many people have no symptoms. While you may think having slightly high sugar levels can't be too bad if you don't have any symptoms, this matters because a high concentration of sugar can be toxic to cells. In a way, think of how honey has been used for funerary practices in many different cultures to mummify a body. This is because high concentrations of sugar create an environment hostile to microscopic life and can lead to poor blood circulation, which damages your heart, brain and kidneys. This is why it matters. Remember, it's not the occasional high sugar that causes health problems. It's prolonged high sugar concentrations that cause permanent damage. That's why even if we don't feel anything abnormal, when our body is unable to regulate the high level of sugar in our blood, it's important to start regular treatment as it prevents damage to our vital organs, allowing us to lead a longer life. Speak to your doctor or telehealth service of your choice about your blood sugar level or if you're concerned about diabetes. You should seek specific advice about your health in general, if you should be on medication or if the medication that you're already taking is right for you.